it's really about putting the woman central, right? And so think about the local context, the needs, and put that central. And this is, if you just think about the implications of what we are discussing here, the situation has so massively shifted. And so even when you think about the forecasting that we would have to do for countries like Nigeria or other countries, in terms of what is needed pre-COVID and now, we will see a complete change in the methods that women will access, how they will access, etc. And I think we just really need to internalize that and think about this also as an opportunity to do things differently. And I'm just thinking about the gender implications of how in this shift we can actually think in a more transformative way. How do we make services more responsive to the needs of women, right? And so that could be around telehealth. In many countries, women still have to walk a long way and wait 5 hours before they can be seen, right? So is this an opportunity to think about women and their livelihoods in a way that is much more empowering and more modern, right, than it has been before? And I mean, I'm personally also really concerned around the donor dependency in terms of the financing of family planning commodities, and that just want to put that out there as sort of the sustainability and the domestic financing for the SRHR agenda is incredibly important now more than ever. Now, on the learning platform, and it's all interrelated, we have for a long time had an experience with a learning platform and a community of practice where we really see our role more as facilitators to allow for a safe space for countries to exchange. As we see in terms of the innovations really taking place in the local context, and there's incredible value for countries to be able to exchange and learn from each other, much more than having experts coming in and doing speeches, etc. And so building on that and realizing that we had a completely unprecedented situation when the pandemic happened, we extended that by saying, okay, we cannot travel, we cannot have joint meetings, we cannot work together. Let's make this more action-oriented. And so we had 10 countries that volunteered, and we're focusing heavily on service delivery, bringing them together twice a week and really exchanging in small groups and between countries on what needs to happen, what is the data that we're seeing, where do we see constraints in the commodity availability. And it also has allowed us to really gain a lot of insight what's happening in these countries and better tailor our other support, whether it's financial or through analytical work or technical assistance, better tailor that support to the needs of countries.